Cause of death in a hanging. First is asphyxia. The constricting force of the ligature causes compressive narrowing of the laryngeal and tracheal lumina and forces up the root of the tongue against the posterior wall of pharynx and fold up the epiglottis over the entrance of the larynx to block the airway. Obstructions of the airway usually causes a struggle known as air hunger. If entry of air into the lungs is completely prevented, death occurs rapidly with marked asphyxial signs. A tension of 15 kilogram on ligature. 15 kilogram ligature block the trachea. Next is venous congestion. If the node is situated in the chin area, venous outflow flow is obstructed, but arterial flow is may continue. The jugular veins are blocked by the compression of the ligature, which results in stoppage of the cerebral circulations and a rapid rise in venous pressure in the head and unconsciousness. This occurs if the ligature is made up of a broad and a soft material, which cannot sink into the tissue to any depth. The jugular veins are closed by a tension in the rope of 2 kilogram. Next is combined asphyxial plus venous congestion, some commonest cause. Next is cerebral anemia. If the node is situated in the region of the nape of the neck, both arterial and venous blood flow are cut off by pressure of the nerves on both sides of the neck. Pressure on the large arteries on the neck produces cerebral anemia and immediate coma. Within 10 to 15 seconds, the pressure is immediately released, the consciousness regained in 10 to 12 seconds. Death will be slow and asphyxial features are very less marked. This occurs when the ligature made of thin cord which sinks deeply into the tissue. A tension of 4 to 5 kilogram on ligature blocks the carotid artery and 20 kilogram the vertebral artery. This is much less common than the venous occlusions. Next is reflex vagal inhibition from pressure on the vagal sheath or carotid body. Fear, apprehension, struggling, and possibly alcohol may heighten the sensitivity of the vagal mechanism. The release of catecholamines during such adrenal response may sensitize the myocardium to such a neurogenic stimulation. Next is fracture or dislocation of the cervical vertebra. This occurs where there is a free fall and sudden jerk during hanging, as in judicial hanging. The above cases may act independently or in concert. Then is about the delayed death. Delayed death. It can be due to delayed death can be due to infections, edema of the lungs, edema of the larynx, and aspiration pneumonia, edema of hypoxic encephalopathy, thus infection of brain, abscess of brain, and cerebral softening. The secondary effect of hanging in person who have recovered are sometimes hemiplegia, epileptiform convulsion, amnesia, dementia, cervical cellulitis, parotitis, retropharyngeal abscess, amnesia, and dementia. Thank you.